Hello and welcome to Crack the Boards. In today's video, we will focus on USMLE questions related to microbiology. Let's have a look at the first question. A 28-year-old woman presents to the emergency department with a 2-day history of fever and pelvic pain. 5 days earlier, she had a medical abortion using mifepristone. She's diagnosed with an endometrial infection and toxic shock syndrome and is hospitalized. A gram-positive, toxin-producing anaerobic bacillus is identified from her cervical discharge. Which organism is the most likely cause of her infection? A. Clostridium sordeli. B. Pseudomonas aeruginosa. C. Staphylococcus aureus. D. Streptococcus pneumonia. E. Streptococcus pyogenes. Now the correct answer is A. Clostridium sordeli. Clostridium sordeli is a gram-positive anaerobic bacillus. Mifepristone binds to glucocorticoid receptors, causing dysregulation of cortisol and cytokine release to compromise the host defense mechanisms necessary to contain a Clostridium sordeli infection. In addition, Clostridium sordeli produces hemorrhagic toxin and lethal toxin, which are the two major contributors to the fulminant toxic shock. Let's have a look at why the other options are incorrect. Option B is incorrect, as Pseudomonas aeruginosa is a gram-negative bacillus and common cause of sepsis and septic shock in debilitated and immunocompromised patients. Option C is incorrect, as Staphylococcus aureus is a gram-positive coccus that grows in clusters. Staphylococcus aureus can be normal flora in the genitourinary region and can produce toxic shock syndrome toxin. Option D is incorrect, as Streptococcus pneumonia is a gram-positive diplococcus and is unlikely to cause endometrial infection or cause toxic shock. Option E is incorrect, as Streptococcus pyogenes is a gram-positive coccus that grows in chains. Streptococcus pyogenes makes pyrogenic exotoxins that are superantigens and can cause toxic shock. Let's have a look at the second question. A 25-year-old woman presents to the emergency department with 2 days of fever, chills, fatigue, nausea, vomiting, diarrhea, and abdominal pain. She works as a kindergarten teacher in a school where several students have fallen ill in her class. On examination, her liver appears significantly enlarged. Lab results show elevated ALT and AST levels with mixed hyperbilirubinemia. Bacterial and fungal cultures are negative, but viral serologies and picornavirus isolation from her stool sample suggests a viral cause. Which virus is most likely responsible for her condition? A. Epstein-Barr virus. B. Hepatitis A virus. C. Hepatitis C virus. D. Hepatitis D virus. E. Immunodeficiency virus. The correct answer is A. Hepatitis A virus. The virus responsible for the patient's clinical manifestation is hepatitis A virus, a member of the family of Picornaviridae. Hepatitis A virus is transmitted by the fecal-oral route, and the incubation period is generally 2 to 4 weeks. Outbreaks occur due to exposure to contaminated food, water, or from person to person contact. The manifestations of hepatitis A virus infection, such as malaise, vomiting, jaundice, dark urine, acolic stools, are due to inflammation-mediated damage to the liver. Let's have a look at why the other options are incorrect. Option A is incorrect, as Epstein-Barr virus is a member of the family of herpesviridae that causes infectious mononucleosis. This virus is transmitted by saliva and presents with pharyngitis, fever, posterior cervical lymphadenopathy, and splenomegaly. While the liver can be enlarged, AST and ALT are not typically affected in mononucleosis. Option C is incorrect, as hepatitis C virus is a member of the family of Flaviviridae and is transmitted most commonly by intravenous drug use or via sexual contact. Patients are less likely to present with acute symptoms, as most typically develop stable chronic infections. Option D is incorrect, as hepatitis D virus is a member of the Delta virus family and requires hepatitis B virus surface antigen to be infective. It is transmitted by contact with infected blood or body fluids. Option E is incorrect, as human immunodeficiency virus is a member of the retrovirus family and is spread via the parenteral route, which is sexual contact, needle sharing, blood product transfusion. The acute illness phase occurs around 1 month after infection, presenting with a flu-like illness. AST and ALT are not typically affected in acute HIV infection. Let's have a look at the third question. A 5-year-old girl is brought to the physician by her mother due to swelling above the clavicle that has been present for the past 2 weeks. The child has also been feeling generally unwell and experiencing muscle aches, although she has not had a fever. About 3 weeks ago, she developed a small erythematous rash on her left index finger, which later formed an overlapping crust. Otherwise, she has been healthy and has never traveled outside Finland. Her mother reports that the family owns 2 pet cats. On physical examination, the child has tender lymphadenopathy in the left cervical and axillary regions, with nodes ranging from 2 to 3 cm in size. Blood cultures are negative. What is the most likely causative pathogen? A. Bartonella henselae. B. Francisella tularensis. C. Legionella pneumophila. D. Mycobacterium tuberculosis. E. Staphylococcus aureus. The correct answer is A. Bartonella henselae. This patient has cat scratch disease, which is caused by Bartonella henselae. In children, cat scratch disease most commonly presents with regional painful lymphadenopathy. Classically, there is an ipsilateral cutaneous lesion that precedes the lymphadenopathy. This primary inoculation lesion evolves from a vesicular lesion to a papular lesion but remains erythematous and nonpruritic. It may not be present at the time of the presentation. Bartonella is very difficult to culture, and absence of growth on a blood culture does not exclude the diagnosis. Let's have a look at why the other options are incorrect. Option B is incorrect, as Francisella tularensis causes tularemia, which usually results in an abrupt onset of fever, malaise, and rigors. Tularemia comprises at least 6 clinically distinct syndromes, with the glandular subtype most closely approximating the presentation in this case. Tularemia would be more likely if the child had been febrile. Option C is incorrect, as Legionella causes a pulmonary infection that is often associated with neurological and gastrointestinal symptoms. Option D is incorrect, as Mycobacterium tuberculosis could present like this case, but in the absence of fever or a history of travel, it would be lower on the differential diagnosis list, especially considering it is fairly uncommon in Finland. Option E is incorrect, as Staphylococcus aureus can cause acute unilateral lymphadenitis that would present with tender lymphadenopathy, but fever would be expected and cutaneous manifestations would not be expected. This concludes today's set of questions. Thank you for watching today's video. If you enjoyed it, please don't forget to subscribe to this channel to stay updated on our latest content.